And the colder weather comes with scarves, boots, and the dreaded flu. Most people turn to getting a shot to avoid getting that flu. Angela Barnett from the Waverly Health Clinic joins us today to talk to us about what's true and what's not true about the flu shot. So thank you, first of all, for joining us today.
Yes, thank you.
So one of the biggest things, myth, fact, I'm not really sure about getting the flu shot is that it actually will give me the flu when I get the shot.
Yeah, that's a common misconception. That is a myth, and the flu shot does not have any live vaccine in it at all, so it cannot make you sick. And the flu mist that we also use has a very small diluted live vaccine in it, but it is not meant to make you sick. There's not enough amount in it to make you sick. It's actually to help boost immunity. So that is a common misconception, though.
And so there are toxic levels of mercury in the vaccine. Is this a myth or is this a fact?
That's also a myth. The vaccines are now preservative free, and if there are any levels of mercury, it is so small that it is not harmful to us.
And so what are some of the steps people can take to avoid getting the flu?
First of all, washing your hands is the main thing that you can do to prevent getting sick. Also, staying away from people who are sick or avoiding close contact with those people that you know are sick. Also, when you're sneezing or coughing, using a tissue, and then washing your hands right away after that.
And can it lead to any other illnesses?
It can actually, in people that have some chronic health conditions, it can actually exacerbate those, such as like asthma. It can also cause, other illnesses like pneumonia, bronchitis, sinus infections in those people that have a lower immunity system, a weakened immunity system.
And so when would you say the best time is to get vaccinated?
Typically between October and January is going to be the best time to get your flu vaccine. We usually see numbers of the flu virus peaking in January, and so we do recommend to get your vaccine before that. It takes about 2 weeks once you get the vaccine or the mist to work, so for that to boost the immunity. So we do want you to have that, before the numbers of virus start to increase.
Now you're talking about this mist. Kind of explain what that is.
It's just, it goes in each side of your nostrils, and it's just a vaporized little liquid, and we just give it into each side of your nose, and you kind of sniff a little, and it's done. So it just kind of evaporates or, vaporizes once it's in your nose. So it's very quick and easy, and most people prefer it over getting a shot.
So would you say you've seen more or less people coming in because they're sick, because they're getting that nasal spray? Or
Yeah, we have had the nasal mist for a year or two now, and we can use it on ages 2 to 49 in patients that don't have a lot of chronic asthma or health conditions, so we do see a benefit in that.
And so where can people go to get vaccinated, and is it covered by insurance, or what's it cost?
Yeah, typically it is covered by insurance. Most insurances want you to get the flu vaccine and promote that, so they do cover it. There are places all over to get them. You can get them at your doctor's office, you can get them at pharmacies, you can get them at the hospital, urgent cares. Schools and hospitals typically offer them for their employees and students as well.
Well, thank you so much for being here today.
Thank you.
For more information about how you and your family can stay healthy this season, visit the Waverly Health Center website.